Okay, so here we have another protocol for possible treatment of the back, the lower thoracic, the lumbar or the sacroiliac area. So we have our return plate with water and gel connected to the sternum with the surcingles. I'm going to start with a capacitive resistor, whatever size you prefer on the size of the body. So I'm going to do a 20-minute treatment on here. So I would start with some water on the back, apply some gel to the electrode, and then we can just start the treatment. So this could be for anything simple as soft tissue pain. If the saddles create compression and we have some soft tissue pain, epaxial muscles, you may have some facet joint problems. It may be post-surgery with kissing spines. So it can be used for any kind of thoracic, lumbar, sacroiliac area pain. So we're starting with a 20-minute procedure. So I would tend to split it into a quarter of the time with a capacitive electrode, which is to prepare the tissue, to treat locally, to help with the blood supply, to hopefully make the resistive treatment more effective. So I would spend 5 minutes just working around, just warming the tissue up, and make sure to keep an eye on the heat. So I tend to use my fingers and my hand to keep an eye on the temperature, or you can put your other hand on and you can work along at the same time. So for around about 5 minutes, just working backwards and forwards through the area of the body that you would like to treat. And then once that 5 minutes is up, what I'm going to show you here is the use of the bracelets. So you could use the electrode, the resisted electrode. So very simply, you can just disconnect from here. And then we can take the connector to the bracelets, just fits in really simply. And you can use one or two bracelets, you don't have to use them both. I tend to use both together just to get a maximum treatment area. So slip these on anywhere from the wrist up to the elbow is fine. I tend to try to just keep the wires out the way a little bit. You will tend to kind of get them a little bit touching the horse, but you can easily just get the horse to get used to that. A little bit more gel on my hands. Now with the Back3, the current will split between the two electrodes. So we've got a setting of about 40% on here, so we've got 20% coming through each hand. If I have one hand in contact, then full 40% will go through that one hand. If I have two hands in contact, then it will be split 20% through each. Also bear in mind the surface area of your hand. If you have the whole hand in contact, you've got a large surface area. If you reduce the surface area down to smaller contact, bear in mind that the heat will be greater, and keep an eye on the amount of heat you're producing. So the excellent thing I think about the use of the bracelets is you can add to your manual therapy, so you can add to your massage techniques. You could do some trigger point release within the same tissue. So just bear in mind, if I take this hand off, you've got all the current going through a small area, so just be really careful about the amount of heat you can produce. So with my hands on here, I've got an input through here, and then using this I can find those trigger points, and I can treat those trigger points as well and work through the area you want to treat. Myofascial as well, you can quite simply do a myofascial release. And I say, just be aware of where your other hand is, so you can have it really close to the other hand, or you can separate it and treat two different areas. So the versatility of using the bracelets, I think, is really good. I tend to use the bracelets a lot on horses in particular. So you can work through the body. You can do that for around about the 15 minutes. Once the time is done, then you can do another couple of minutes of capacitive if you want to. I tend to leave it there.